Dear students, welcome back. In the previous session, we have seen the valves of the heart. Now, we are going to see the surface markings of the cardiac walls and the auscultatory areas. Actually, if you can see here, so this blackened parts are the walls of the heart. These are the actual location of the walls of the heart here. Okay, so here these are the walls. How many walls are there? Yes, we are having 4 walls. One is the aortic. So here this one is the aortic wall, and this one is the pulmonary wall, and on the right side you will have the tricuspid, and this one is the mitral wall or the bicuspid wall. These are the 4 walls which are actually located, and here where exactly it is present, those things we are going to see now. And the sounds produced by closure of the walls of the heart. So the heart sounds are produced by the closure of these walls, and this can be heard by the stethoscope. The sounds arising in relation to the particular wall are best heard not directly over the wall, but areas situated some distance away from the wall. That is the area where in the direction of the flow of blood. So that is the area where you have to keep the steth. Okay, you have to auscultate. You can't hear a clear sound when you put this head of this stethoscope directly on the presence of the wall. You have to place it some distance to the wall. Then only you can hear the clear sound of that heart in the direction of the flow of blood. And these areas are called as auscultatory areas. Here you can see these are the auscultatory areas of the 4 walls. So here this one is the pulmonary wall, isn't it? This pulmonary wall, and the distance which is away from this wall in the direction of the flow of blood, and this one is the pulmonary wall auscultation site, and this one is the aortic wall auscultation site, and this one is the tricuspid wall, and this one is the mitral wall. If you can see here, so the blood is flowing here through the direction, in this direction. So the auscultation areas is also present in the direction of the blood flow, but away from the actual site of the wall. Okay, and in the case of this pulmonary, here this is the direction of flow of blood, and in this aortic also this is the direction of flow of blood. So these are the auscultation areas. Now we are going to see where these auscultatory areas are actually present. Okay, yes. So, and what is the diameter of the wall, and where is the exact auscultatory area which are present. So these are called as the surface marking of the cardiac walls and the sites of the auscultatory areas. So now we are going to see the position of the valves in relation to the surface of our body and of the auscultatory areas. Now the first one is the pulmonary wall. So which is the pulmonary wall here? Yes, this one is the pulmonary wall. So the diameter of the orifice is 2.5 centimeters, and the surface marking is It is a horizontal line 2 centimeters long behind the upper border of the third left costal cartilage and adjoining part of the sternum. So if you can see here, this is the third rib and this one is the third costal cartilage, and this is the area where the marking of this pulmonary orifice, so that is the behind the upper border of the third costal left costal cartilage, this is the left side, left costal cartilage and adjoining part of the sternum, this one is the sternum and adjoining part of the sternum. This is the exact location of this thing. What is that? Pulmonary wall. Okay, now coming to the auscultation area in relation to the surface of our body, where this is the exact position of the pulmonary wall located. So where behind the upper border of the left third costal cartilage and by the side of the sternum, isn't it? Yes, now we will see. So where is the auscultatory area of this thing, of this wall is? It is present in the second left intercostal space near the sternum. Here you can see this is the second rib and this one is the third rib. So this is the second intercostal space near the sternum. This is the pulmonary wall. If you want to hear the sound of this pulmonary wall, you have to auscultate in between the second and third rib, that is the second intercostal space. Okay, this is the auscultation site for pulmonary wall. Now coming to the aortic wall. So here comes the aortic wall. The aortic wall is also 2.5 centimeters. It is a slightly oblique line, 2.5 centimeters long behind the left half of the sternum at the level of the lower border of the third costal cartilage. So aortic wall is present, orifice is present on the upper border of the third costal cartilage, left third costal cartilage, whereas this aortic is present behind the left half of the sternum, behind the left half of the sternum at the level of the lower border of the third costal cartilage. So this aortic is present at the lower border of the third costal cartilage behind the left half of the sternum. Okay, and now the auscultation area of this aortic wall is the second right costal cartilage near the sternum. So this one is the second right costal cartilage near the sternum. This is the auscultatory area. Now coming to the mitral wall. So mitral wall or the bicuspid wall. So this one is the mitral wall. So the diameter is 3 centimeters and it is an oblique line 3 centimeters long behind the left half of the sternum opposite to the fourth costal cartilage. So this is also an oblique line and it is of 3 centimeters long behind the left half of the sternum opposite to the fourth costal cartilage. Okay, and coming to the auscultatory area of this one is the apex of the cardiac apex, which is present in the fifth intercostal space. So this is the auscultatory area for mitral wall. Okay, now coming to the tricuspid wall. The tricuspid wall opening, the tricuspid opening has a diameter of 4 centimeters. It is most obliquely present. It is most oblique of all the walls. If you see all these walls, so the first one is almost horizontal line, that is the pulmonary wall, and the next one is the aortic wall. This one is slightly oblique line, whereas mitral wall is more oblique than the aortic, and tricuspid wall is most oblique of all the walls, and which is being nearly vertical. This one is 4 centimeters long behind the right half of the sternum. It is present in the right half of the sternum, opposite to the 4th and 5th spaces. Opposite to the 4th and 5th spaces. And the auscultation area for this one is the lower end of the sternum. This one is the auscultatory area. This is the lower end of the sternum. So these are all the surface markings of the cardiac walls and the sites of auscultatory areas. So most of the 3 walls, one is the pulmonary wall, aortic wall and mitral wall, is present on the left side behind the left half of the sternum, whereas this tricuspid wall is present on the right side of the right half of the sternum. Okay, and the auscultatory areas also, the 3 auscultatory areas, that one is the pulmonary, apex, pulmonary, and this mitral wall, and the tricuspid valve auscultation areas are seen on the left side, whereas the aortic only we can hear the sounds on the right side of the sternum. So these are the auscultatory areas. Okay, one auscultatory areas at the second intercostal space, that is the pulmonary, and next one is the cardiac apex, is the mitral wall, and aortic wall is the right side second intercostal space, and tricuspid wall is at the lower end of the sternum. These are the auscultatory areas of the walls of the heart. In the next session, we are going to see the applied anatomy of the walls of the heart. Thank you.